A very good morning, everyone. Thank you at the outset to all the Rotarians here, DG Saravanan, Conference Chair Ravi Sundaresan sir, for this opportunity for me to represent VS Hospitals and VS Medical Trust in presenting to you the present picture of the disease burden that's facing us in terms of breast cancer, cervical cancer, and what we can do towards that. So, first up, I think I'm honored to stand in this forum simply because there is such a large congregation of Rotarians here. I mean, if you today equate, when you talk about search engines, you talk about Google, you say Google pannunga, and if you want to take a photocopy, you commonly say Xerox. Similarly, if you were to, look for an antiseptic, you would say use Dettol. So similarly, I think you Rotarians have set the gold standard in terms of philanthropy. Soon it may become common, யாராவது ஏதாவது சர்வீஸ் பண்ணுறாங்கன்னா நீங்கள் ரோட்ரி பண்ணுங்கன்னு சொல்லலாம்னு நினைக்கிறேன். I think you've set the real gold standard in terms of philanthropy and service. Yeah. With that, I'll move on to. So I'll briefly talk to you about the cancer burden facing us today. This is not to scare you, but to just put a perspective on what actually we are facing. So every year we have 2 lakh new breast cancer cases, which approximately means every 3 minutes we have someone detected with breast cancer in India. In terms of cervical cancer, there are about 1,30,000 cases every year, and which means every 4th minute you are detecting cervical cancer in India. And the sad part is we continue to detect these cases late, and so we are actually losing every 5th minute we are losing a woman to breast cancer, and every 6.5 minutes we lose a woman to cervical cancer. These are scary stats. Yeah, so every year we have up to 100,000 deaths in India towards breast cancer, and this accounts for 50% of the global load. In terms of cervical cancer, there are about 80,000 deaths every year in India, and that accounts to 23% of the global share. And this slide tells you that we catch our cancers much later. And that's the reason why the mortality is very high in developing countries as opposed to the developed countries. So what do we do about this? Now, we talked about the bad news. The good news is that we can save people if we catch them early enough. So when we catch them in the stage 1 and 2 in breast cancers, we can save up to 90% of the women. And in terms of cervical cancers, we can save up to 80%. So how do you go about save these women? In terms of breast cancer, mammography is the gold standard. But unfortunately, for a large country like India, we have only about 2,700 mammograms, which is about 1/5, or only 5% of what a country like the US has. And imagine we have 4 times their population. So that is the disparity. And even those mammograms that are there are concentrated in the cities. So, along with the Rotary Club of Madras, VS Hospitals and VS Medical Trust came up with a mammo bus. I'd like to thank the Rotary Club of Madras and all the sponsors for giving us this mammo bus, which is housed with not only a mammogram, but a thermal screening device, ability to do dental screening, cervical screening, and also some diagnostics in terms of laboratory work. So this is a comprehensive bus that is donated by Rotary Club of Madras, which we are now using to screen people in the suburbs. So how does this help? Now, since people don't go towards mammograms themselves, we are now able to go to those suburbs and serve the underprivileged where they are. So this bus is actually housed right outside. So any of you can take a look at it when you're around. It's right outside in the porch. So what have we done so far in terms of the screening? We, we've done about 27 camps so far and screened about 3,061 people so far. We've done all these tests that are listed here, including the mammograms, the pap smears, thermal screening. And what importantly we do is, every time you go out there and tell someone we're going to do a cancer screening camp, no one turns up. So we position it as lifestyle disease screening, where we offer blood tests which detect even things like diabetes or your cholesterol or your liver function. So we do comprehensive tests for people, and we've been able to do significant detections using this, and it's very helpful to the community. Today, we also have right outside when you walk out of this hall, we have our stall where our team is sitting there helping people do their screening today. So, request all of you to take a few minutes to take an opportunity to get yourself screened and know about cancer awareness. So, how can you Rotarians work with us? I think we've got the Mammo bus, we're doing a lot of camps, but unfortunately, we are not able to do as many camps as we think we can. For two things. One, every camp is expensive. We are now doing it through our trust, but more importantly, we are also not able to find camps. So we offer our services to all you Rotarians to try and utilize this facility and do more camps. Secondly, I think with the Mammo bus that we have, we are currently able to only cover the Chennai and whereabouts. So we definitely would love to work with all Rotarians across the district to set up more units as well across so that we can cover a larger geographical area. We could work with you in doing awareness drives, doing awareness programs in various centers. And when we detect these cancer cases, very often these are very underprivileged people who cannot afford to take treatment to the next level. So we look forward to your support in helping these people and saving their lives. And this is not a small endeavor. So for continuing to do this and expand the work we do, we would request you to channelize your corporate ties to help us with the CSR. So together, we can work on early detection, provide accessible care to the underprivileged with all the help of your community support, and empower the women. The women are the fulcrum of our society, and empowering them and saving them, I think, is the responsibility of our society. A few words about our hospital. We started in 2004. Our founder, Chairman Professor Subramanian, started this as a 75-bedded unit in Chetpet. We started the next unit in Kilpok in 2016. And by June, we'll have two more units, one in Tandiyarpet, North Chennai, and the other in Tirunelveli. North Chennai houses about 50% of Chennai's population, but the healthcare there is definitely a lot to be desired, and I think this will change the healthcare scenario in that area and bring about a lot of change in the health of those people. I would like to also talk about this cancer risk assessment, which is a very unique tool. Even if you're not doing your screening test here, kindly take a minute. It just takes a minute to do this cancer risk assessment. It's a unique AI-driven tool where you just need to scan this QR code. It'll ask you a set of questions, and we'll be able to tell you what your present position in terms of cancer risk is and what you need to do to take care of yourself. So it's a unique tool. Definitely make use of it and get yourself assessed today. So on that account, I'd like to thank you once again. I think Sanghamitra, in one word, I'd say, idu vandu Brahmandam. That's all I can say. And like the tagline says, it's all about friendship. And it is, in Tamil, it is a Sangamam of all the Mitragal. So thank you. This is probably the largest congregation of selfless people that I've seen. Rotarians, it's all about selflessness, and the only benefit you get out of here, I think, is make these friendships. So continue to make these friendships, and we'd love to work with you all in making a change to this community. Thank you once again for the opportunity.